Now we're looking at a consideration, and this consideration is brought in when you want to image patients. So if I want to take image image of a patient, one thing I'll put into consideration is the type of clothes the patient is putting on, the type of jewelries they have on, and if they have wounds. So those wounds have dressings. I have to put all those things in consideration. So we want to now give more knowledge to ourselves that why should you actually consider these things. So let's pick them one by one. First of all, this is the clothing. So you have to consider them, right? Because they could affect how neat your image will be like, So clothing considerations include you are removing obstructive clothing, like all those thick fabrics. Maybe the clothes had buttons, maybe the clothes has zippers, all those embroideries. Do you understand? That will actually affect how neat the image will be like, right? Sorry, I have sore throat. So you provide gowns, right? So loose clothing for patients to wear. Maintain dignity, so ensure privacy. You don't go and start imaging a patient, recording a patient with your phone when they are almost half naked. You understand? And all of that. So the next things you look at is the jewelries and accessories. You make sure that they have removed every metallic object on their body: necklace, earrings, watches or hairpins, piercings, because it could actually affect the image quality. Also, head and facial markings, all those glasses, dentures, hearing aids must be removed. So you document. So if jewelries cannot be removed, maybe for cultural or medical reasons, you have to state it in your report. So safety ensures that jewelries does not interfere with immobilized devices or patient positioning. So surgical dresses and medical devices is all those bandages, casts, wound dressings may affect the anatomy or the clarity. So you always have to consult with the physicians before removing or adjusting the dressing. That's for surgical dressing. So medical devices like catheters, intravenous lines, pacemakers, or monitoring equipment must be protected and not displaced. So this one is not the aspect of removing now. You have to be careful because you don't want to change their position. So that's just what we got for these things, and why it's very important to always interact with your patient before imaging to know if they have any of this.